Once upon a time, there was a little girl who loved her grandmother deeply in her heart. But the grandmother suffered a lot from diabetes, hyperthyroidism, and later on dementia that couldn't be diagnosed at that time in one of the developing countries. Soon after, the grandmother died. May Allah rest her soul in peace, and the space she left in her life has always been the motivation to take care of elderly people and was the reason behind selecting geriatric mental health nursing among other professions. Hello, this is Sarah Yakmur. Today I'm going to give you just a general information regarding psychogeriatric nursing. The main objectives from today's video is to be able to identify the field of psychogeriatric nursing as one of nursing specialties. It is important to know about mental health as the mental health problems consider international and national concern. Moreover, more than 30% of adults are estimated to experience at least one form of mental distress within 1 year. Furthermore, there is lack of understanding of the role and value of the mental health nurse. Also, there is lacking in qualified nurses in psychiatric area, and the community are affected by social stigma related to mental health. Mental health, known as a state in which an individual has a positive sense of self, personal and social support with which to respond to life's challenge, meaningful relationship with others, access to employment and recreational activity, sufficient functional resources, and suitable living arrangement. Conversely, mental illness is a condition of impairment and disorganization of mental function for an individual. Primarily, the term psychogeriatric appears in dictionaries within the last 20 years. However, while searching health databases, the psychogeriatric and geriatric psychiatry term been shown in literature after 1990s. Nevertheless, it is important to know that approximately 15% of adults aged 60 and over suffer from a mental disorder. Neuropsychiatric disorders such dementia and depression among the older adults account for 6.6% of the total disabilities, and anxiety disorder affect 3.8%, while substance use problems affect almost 1% of them, whereas nearly 25% of deaths from self-harm are aged people. A psychogeriatric nurse is a registered or enrolled nurse whose practice, whether in the clinical, management, or academic setting, is focused on the older person with a mental illness and/or a cognitive impairment. Nurses in this area receive additional training in psychological therapies, building a therapeutic alliance, dealing with challenging behavior, and the administration of psychiatric medication of the older person. However, according to the World Health Organization, the elderly person usually being of age 60 years and or greater age. I can't really say how much nurses are important in psychogeriatric field, as they form the first line in dealing with clients, families, and other healthcare workers. Conversely, the psychogeriatric consider a new trend in healthcare arena, especially in developing countries such as Saudi Arabia and most Middle Eastern countries. Therefore, knowing its term and associated practices will help to meet elderly's quality of life and healthcare development. A psychogeriatric nurse in mental health setting are providing therapeutic relationship, psychosocial intervention, and spiritual intervention, as well as physical and biological interventions such as psychiatric medication, electroconvulsive therapy, and physical care. The psychogeriatric nurse have special characteristics such as clear insight with high self-understanding, good judgment and critical thinking, high sense of moral values, good and effective communication skills, highly observant, competent, punctual, cooperative, and calm, as well as have both psychiatric and medical surgical nursing skills and knowledge. Essential elements needed are nursing ethics, code of ethics, accountability, responsibility, confidentiality, standard policies and procedures, knowledge and skills, veracity, fidelity, autonomy, and fairness. Mentally ill consumers have the right to privacy, informed consent, right of minors, refuse treatment, be treated, and reproductive and sexual rights. To help them all living happily ever after.